I guess I spent many years before becoming a health coach in a completely different space, which was in business. And I felt in a lot of ways that it kind of chose me. So I very deliberately went out there looking for something. And at that point, I didn't really know what it was. And then I came across specifically health and wellness coaching as an occupation. And that definitely wasn't around like 18 years ago when I was looking for career options out of school. And I jumped at the chance at learning it, and it's been amazing. And I think what it has allowed me to do is to intersect an ability to help people navigate what happens with career and the world that you go into in business and corporate life, with how you balance that out with your health. And I think that's a really important aspect for me to bring to my work, and it's sort of where my experience lies. And being able to bring the health coaching into that was certainly a way for me to get into a field that I've actually always been passionate about. I just never got into from the start. For me, the turning point to move out of the industry that I was in and the work that I was doing was, it's never a simple thing, and it's usually a multitude of factors. But the one thing for me was I developed a health condition that was, I think, in part due to a lot of just, the factors of a really demanding job, not to mention overlay that with becoming a new mum. But I think what I would have actually really loved to have known is strategies to put in place to live life in a modern way that is also sustainable, and that you can keep going. Like, you don't have to go crazy and then stop and then, have a little third life crisis, as I kind of called it at the time. So yeah, it was just a combination of things, but in the end, as always, I'm glad that it happened that way, because I probably wouldn't be in the job I'm doing and, feeling like that what I do has a little bit more meaning that I was doing compared to what I was doing before. The best thing about coaching is by far giving people the one commodity that I feel, and that was my experience anyway, that people feel that they're absolutely lacking, and that is time for themselves. So I think the absolute gift that coaching offers is for people to be able to sit with someone else, but for them to hold space just for them. And I think in this day and age, it's really rare. Like, we're scheduled out. So sometimes being accountable to a schedule, even if it's a session with a coach, can actually be really beneficial. So I like being that person to hold space for others. I love helping patients with getting simply from point A to point B. So they've got a goal, a health goal, or a destination that they want to get to, and basically just helping them navigate that. And probably more specifically, helping them remove obstacles on that path. Because sometimes when, they've spoken to the practitioner and they've got their plan, it can on paper, like the route can look really simple, but the reality is life gets in the way and you get in the way. And I think the thing I love most is just sitting with people and helping them sort of just carefully pluck away those obstacles and maybe put new things in place that helps the road be a little smoother. I'm a creative person, so I do like helping brainstorm new ways of doing things. So I will hopefully help them see what their situation is from a different angle, or things that they haven't thought before, or where they might feel stuck. We can together collaborate on different ways to working around it. So yeah, just getting a different perspective. The one thing that I would change about the healthcare model in this country if I was in charge would be absolutely people having access to more preventative healthcare options that was financially viable for them. So, health insurers being able to cover things that the evidence is certainly mounting for, that actually helps prevent disease and also helps reverse disease that already exists. I think that certainly needs to become more accessible.